Hi, everyone, and welcome to a live chat with Nurse Linda. Today's topic is evolving therapies. Linda Schultz is a leader and provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 2 decades. Now I'm going to turn it over to Linda. Hi, Linda.
Hi, and thank you, Kaylee. Welcome, everyone. Isn't it wonderful that we have Zoom and all these different technologies now that we can do these things? And you can see me, I can't see you, but it's still nice. And Kaylee and Chris are on today, and they work the magic behind all this. I'm just the tweeter box on the wire, the bird just chatting away. But Kaylee and Chris really are the ones that are doing all the heavy lifting here. So thank them very much. We're coming to a time now where COVID is winding down. I've been hesitant to say those words because, you never know what's going to happen next. It could flare up again. But right now, COVID is winding down. And so I always like to just put a little brief mention about caution in going out with spinal cord injury or with any neurological issue. There can be issues with immunosuppression. So your immune system might not be working up to par. Now, it's difficult to tell with individuals whose is working really well, who's working semi-well, and who's not working so well at all. It doesn't really match up with your level of injury or time of injury. It's just, the way our different bodies work and function. So I just always like to mention err on the side of caution. When you're going out, we can go out without masks now. I myself do not. I still wear my mask when I go out, just because I have suppression issues, and you just don't know what's going on out there. So there's a lot of conflicting information. So I think it's just better to err on the side of caution, still doing the hand washing, and I was a hand washer before, but even more so now. I try to maintain my social distance, those sort of things. I have ventured out into the world a couple of times in different capacities, which has kind of been a little frightening. But once you do it, you find out, okay, I'm okay, everything's going fine. So just err on the side of caution, I think, is the thing to say. An interesting thing that happened over this last winter, in the winter, flu tends to rear its ugly head, and we have a lot of flu cases. But since people were isolating at home, so they weren't mixing and mingling so much, wearing masks, doing the hand washing, social distancing, the flu was almost non-existent, even in the people who had to go out for work or other issues. The flu was just, there were hardly any cases reported. So that's kind of a neat thing to find out, is that all of these precautions that we've been taking, they actually work. And they have worked, and we're coming along. Now there's some new variants that we have to think about. There's this Indian variant from India that's ravaging that country, which is so horribly unfortunate. We are such a mobile society that it would be unlikely that that variant would not enter the United States. If it has not already, it has entered other countries. And so we just have to be cautious, because there's always a little caveat. There's always something lurking around the next corner. So just please be cautious with yourselves, because we've made it this far. I always think, gosh, I kind of wondered if I would even make it this far, but yet here we all are. So today I'm going to talk about some of the newer therapies. I used to talk about newer therapies a lot more in the beginning when I started with this, and people would say, why do you talk about these? Because we can't get them and we can't have them. But now it's several years later, and things are kind of loosening up there. Improvements are being made. People are getting a little bit more of these newer therapies. And so I thought I'd go ahead and write about them again and how you can get them. Now, it doesn't mean that just because you go through the process that you will get these things. But if you don't go through the process, you won't. So it's always just a good thing to try and see what's going to happen. So some of the therapies that I've talked about, and there are so many, but there are cure therapies, and there are restorative therapies. So some of the therapies that are trying to, one that's trying to develop, I'll call it a cure, but a treatment actually for the spinal cord injury or brain injury or other injuries is stem cell treatment. And there's a lot of work that's gone on with that. It was very, very popular in the 90s. It was just around the corner. I believed it was just around the corner. I was working with stem cells and doing some human stem cell research projects as a member of that team. And so it was very, very promising. The problem with it at that time was they could create stem cells in the laboratory, but getting them into a person was difficult. And so some devices were developed to do that, because you have to inject the stem cells into that cavity that's left in the spinal cord injury. So when your spinal cord is injured, no matter if the injury is from outside or if it's something that's happened on the inside, like a blood clot or something, when the spinal cord's injured, it leaves a hole in the center of the spinal cord. So there's a little scar that forms in the center of the spinal cord. Even if the spinal cord is injured, like from a bone pressing on the outside of the spinal cord, the damage results in the center of the spinal cord. So it makes kind of like that level of your spinal cord kind of has the shape of a donut. So it has an outer rim and an inner rim, and the inner donut hole there. So to get the stem cells into that hole, you would have to take a needle, which of course then would pass through nerves of the spinal cord, which you could then damage those nerves. So you want to, always look at the risks versus the benefits. You don't want to make anything worse when trying to make something better. But anyway, that they were able to get that mastered. But the problem was that the stem cells would stay inside this hole and they wouldn't grow outside. There's like a little scar that forms around this hole, and the stem cells couldn't grow outside of it. But they have solved that now. They've created an architecture, they call it a scaffold. So if you think of a scaffold out on a building, it's kind of like that. A little way that you could build to keep the stem cells in there. And all of that is progressing. And so they've made huge, huge strides in this, but it's not quite ready for prime time, as they would say. It's not quite ready to be out there. There are some independent people that are out there that will sell you stem cell treatments for spinal cord injury. They'll charge you a lot of money. They'll say, well, we don't really have, we can let you talk to somebody who had results, but there's no way to measure the results. Yes, there is ways to measure. If you have a spinal cord injury, that there's the ASIA exam where you get each dermatome tested. So there are reliable and valid measures for doing that. So be cautious. If there was a stem cell treatment for spinal cord injury, we would all know about it. That's always kind of been my bellwether for any kind of treatments, is if there's somebody who has it and they've just done it secretly and they're in their own little office and they're doing it, and they want you to come, and usually it involves great deals of sums of money that you pay. Always be cautious of that, because if there was something that was actually out there that was ready to be implanted in people's bodies and really working right now today, trust me, the spinal cord injury community would be abuzz with it. So always be cautious of things. Now, there are stem cell treatments that are being done for everything. They've been done in cancer for a long time successfully. There's stem cell treatments that can be done to replace knee cartilage. That's being very successful. We all learn from each other. So we're all learning from those from those treatments that are now available to people. So just be cautious with that. I mentioned stem cells because it is on the horizon. It is coming, and it's coming quickly. So we just need to be aware of these things, and we need to know how to prepare our bodies so that we'll be ready for the stem cell treatment. So you have to be healthy, to be able to do this. So there are other treatments that can get you there. Another process that is in the experimental phase is implanted stimulation, and that is going extremely well. There are several companies. I'm going to mention the FES Center in Cleveland has a product that's an implantable device, and they're getting ready to go to market. So it will be available to people in the future very soon. If it's not out already, I haven't heard of it being released yet. So I don't think it's out right now. I think they got kind of waylaid by the COVID, and, you know, that just messed up everything. I think we can all agree to that. But there are some things you can do to help yourself. They're having excellent results with the research into the implanted stimulation. So that's going really well. As you know, as much as we're allowed to know, research is not, they don't put out a lot of the results until everything is completely validated. So, you know, we just hear little snippets. Sometimes there's an article about a small pilot group and the improvements that they have had, but it's not a big enough group yet to say that, wow, this is really the answer, but it's looking very positive. So we'll leave it at that. Some things that you can do now to help prepare your body and even to make your body more functional in now, and to maintain your body's health, as well as to look forward to the future. There are some therapies that you can obtain pretty easily right now. One is standing. Now that is a static activity. You're not really moving any parts of your body. You're just standing there. There are what they call a standing frame. That's kind of a weird name, like a frame that holds up your body, but it is an outward frame. It's like a chair you sit on, and then there's a pump or a hand pump or an electric pump. And some straps are put on your chest if you need that. Some straps are put around your hip to block your hips from moving, and around your knees. And as you pump up, you can stand up. Now you need, before you start any therapy program, just like anyone, you need to check with your healthcare professional, because you don't want to stand. If you have a blood clot, or you don't want, you know, that could come loose, you don't want to stand. If you have bone density problems where your bones are too weak to support the weight of your body, and you end up with bone fractures, so there's a lot of things that I've written about recently in my blog about precautions for any of these therapies. But standing, we put it in as a therapy because when you stand in the standing frame, you put your weight through your body. There's some other advantages to standing, and that is that when people see themselves standing, maybe they haven't stood for quite a while. It's quite an emotional moment for individuals who start standing therapy. It's very emotional for the families. People get really excited. It's kind of a very happy thing, because, you know, it's not like people are thinking about standing in particular, but when you see somebody who's been seated for a number of years, it's like, oh, wow, this is a good step forward. So you can get a standing frame. A lot of payers are paying for these now. They're not really that expensive, but as you know, medical equipment is always expensive. So standing is a good therapy. You can get attachments if you petition for a standing frame. If you have arm function and you can move your arms back and forth, they have an attachment that as you move your arms, it can move your legs. So you're getting that exercise in your legs, which is kind of cool. They also have like wheels up at the top of the standing frame. So say you're at school, or you're in a business meeting, or you're a child in a classroom, and the activities for a lot of milling around or movement, you can get a standing frame that has wheels up by the chest, so you can wheel yourself around in the standing frame. Now it's a little awkward. It's not as maneuverable as, say, a wheelchair, but it's still, it puts you at the same height of other people. If you're going to a meeting and everybody's there, or you're going to a social hour and people are kind of standing around, then you're standing around too. So that's kind of a neat thing. Now, for a standing frame, check your insurance policy. You have to find the policy that is your policy. So insurance companies have literally thousands of policies. The one that you have purchased is what they will pay for. So you buy a policy that says you have these benefits. Some will have benefits in there. This includes Medicare and Medicaid as well. If you don't have a benefit, you can call your insurance case manager. If you don't have one, call the number on the back of your card and request one. If you have a catastrophic injury or illness, that's going to, which includes anything that's going to be long-term, really, request for a case manager from the insurance company. They can be your advocate to help you get these different kinds of things. You can also go to your healthcare provider, which you'll need to do to see if you're in condition to have some of these therapies. Go to your healthcare provider and ask them if this therapy would be right for you, if you're healthy enough for this therapy. They can write then a letter of medical necessity, which then goes to your insurance company and put in all the reasons, the healthcare reasons, the medical reasons, specifics of your condition, why this would be a benefit for you. And a lot of people are getting success in getting the standing therapy, a standing frame for use at home. So this is a great first step. Now, with any of these therapies that you'd like to try, and you talk to your healthcare provider and they say, yeah, you should try that, but you need to go to a therapist to learn how to do it or to try out the equipment, because nobody has this sitting around unless you're in a certain kind of rehabilitation therapy setting. So usually people have 2 weeks of rehab benefits, usually for mobility training, in their contract. That includes Medicare and Medicaid as private insurance. People often overlook that because they think, well, I won't be walking and that's mobility. Well, no, actually, if you are doing some therapy to strengthen your arms, that will help your mobility down the road. Or if you want to do to learn to drive and you maybe need to strengthen your arms, or you need to learn how to use adaptive equipment for driving, that is all mobility therapy. So mobility therapy can almost be massaged, if you will, into just about anything. So that's a good way to get started with some of these therapies. The 2 weeks that you get do not have to be Monday through Friday for 2 weeks. It could be every Monday for 14 weeks. You could do it 2 times a week for 7 weeks. You can negotiate all of these things. Now, of course, that doesn't, if you have your physician write a letter of medical necessity, or your healthcare provider, and they send it to the insurance company, oftentimes the way the process works is there's an automatic denial. So no, the first time you do it, it probably will be denied. Then you have to appeal. Now, this is where it gets dicey, because the decision from the insurance company will go to the owner of the policy. That might be you, that might be your spouse, that might be your parent, that could be somebody besides you. They may or may not send a copy of that decision letter to your healthcare provider. It goes to the owner of the policy. When you get that letter, it'll have a lot of terminology in it that you probably won't understand, but there will be a place where you can appeal, but there will be a deadline. So do not delay. As soon as you get that letter, if it's a denial, if it's a go, well, then great, you just need to move forward. But if it's a denial, then you need to take that letter directly, get it to your healthcare provider so that they have plenty of time to complete that appeal. You don't want to have it sitting around for a couple of weeks. Maybe you only have 30 days and you've wasted a couple of weeks where your healthcare provider could have been formulating this appeal. You might have to go back and forth with this several times. And in the end, you might just decide, that's enough. I'll do something else. But if you keep going and keep going and keep going, now I'm not saying you guarantee it will work, but just keep going, because the longer you can keep going, the better, you have one more chance to try to get this equipment. So there was a man recently on my TV, had spinal cord injury. He was on the evening news, our local news. because he wanted everybody to know he had gotten an FES bike, a functional electrical stimulation bike. It took him 6 years of appealing to his insurance company. Now that's an extremely long time, but it did take him the whole 6 years to get it. But he was ecstatic. He got the bike. And so he was thrilled, and he wanted everybody to know that it was possible. And it was a fabulous program. I think most of the general public couldn't really understand why this, until you're in the situation, you don't realize how difficult this was. And I have to applaud that man, because man, he stuck with it. He got the bike, and then he went on and told other people, this is how I did it. Just kept appealing. Don't give up. Just never give up. It was a terrific story. I loved it myself. And I'm sure it helped other people out there too. Another thing that you can try, another therapy, is aquatic therapy. You probably, you'll want to check with your healthcare provider. If you have a catheter, you need to seal the area around like a suprapubic catheter so that water doesn't get in there. You need to there's a lot of precautions with water therapy. So, be sure and check this out. Start with a therapist that knows what they're doing. And then you can use that 2 weeks of mobility, have your family member learn to do it. Then you can go to maybe a public pool. You want to see if you can get a heated pool so you don't have that shock of the cold water. But you want to have, the first time you do it, aquatic therapy, because of the pressure of the water on your body, if you are prone to autonomic dysreflexia, it can trigger that. Or if you have spasms and you're in the cold water, it's going to contract you. So work with somebody who knows what they're doing. You can go to pools. They have, sometimes they'll have people that are trained to help other people. There are sometimes people in the community. I had a man come to do some repairs in my house, and we got to talking, what do you do? And he was from another country, and he was educated. He had a college degree in aquatic therapy. Now, he didn't have a license to do this in the United States, but we talked, and I said, well, maybe you should hire yourself out privately, and get a person, try it out. They can maybe make some recommendation. And now he does that as his full-time job. I lost a good guy working in my house, but hey, it worked out great for him. And even better, it worked out for a lot of other people. So he does that just as not as a licensed person, but he does that as a person who helps people with swimming. He's got some release forms that you have to sign, but he really knows what he's doing. And so he's working now to get his license here in the United States, but he's not practicing as a licensed person. He is just helping people in the water. So it's, legal stuff, but it's working. And a lot of people are benefiting. Another thing that I mentioned was vibration therapy. Vibration therapy has been around for a long, long time, but it's recently come into some keen popularity where people put their leg on a vibration platform. You can stimulate both legs at the same time. You can do it while somebody's standing, if they're either in a harness or if they're on their standing frame, or if they're just in a rehab setting, or you can do it sitting. Sometimes the legs vibrate together. Sometimes they vibrate opposite, vibrating as it's, going like this. It stimulates the nerves and the muscles in the legs. There's getting to be some research that's showing, well, there's always been some research, but there's a lot more research that's showing the positive effects of vibration therapy. So something to think about. Again, you don't want to jump in and just go, you can buy a vibration plate, online. I see one advertised on TV late at night. You don't want to just jump into this, because if you have a blood clot in your leg that you didn't know you had, you always need to be checked. It could shoot that loose, and it could travel to your heart, your lungs, your brain. So you could have dire consequences. The other thing about it, if you have a fracture that you didn't know you had, or if you have an unstable spine or an unstable brain injury or something, that vibration going through your body can offset, make that worse. You don't want something that's going to make you worse. So always get checked out. Something else, don't forget to exercise your lungs. And I always recommended the incentive spirometer. People get them when they're in the hospital. They usually, if it makes it home, they're still in the package. It's a device where you are breathing in to expand your lungs, and then you hold it. During the COVID, so many people who were not ill or injured, or somehow people wanted to exercise their lungs. So they're very hard to find. They're not very expensive. They might be more expensive now because, you know, they were all sold out. So somebody came up with the idea of using straws. So they started with a straw for a smoothie. You know, those are like about a ½ inch around. They're very big because sometimes smoothies are chunky and the fluid's really thick. And so it's a bigger straw. So using a smoothie straw and just putting it in your mouth, closing your lips around and just breathing in and trying to hold it, breathe as deep as you can and trying to expand your lungs with that smoothie straw. If you can cut it in half, you just don't want it, you know, to inhale it. So don't make it too small. But if you wanted less resistance, you can cut it in half so that you're only trying to get it halfway through that straw and then eventually build up to the whole straw. You know, we're not training for the Olympics in any of these therapies. Some people are, but generally people are not, even though you are exercising, and even though you do not feel the results of the exercise, your body will. You're not getting the message that you've overdone it. You're not giving the message that you pulled something. You're not giving the message that your body's fatigued or aching or whatever, but your body, so start out very, very slow, like 5 reps. That's enough of any of this stuff. Anyway, so after using the smoothie straw, then go down to McDonald's or fast food size straw. They're a little bit bigger. Then go down to the size of a straw that you buy in the grocery store. Those are pretty narrow. Those are pretty small width diameter straws. And then eventually you can get trying one of those swizzle stick straws and trying to get the air in and out. It really helps clean your lungs, exercise your lungs, make your lungs stronger. Really helps with a lot of things. So some other things that you can do in the therapy setting is to try weight supported walking, where your body's in a harness and there are robotic machines that move your legs. Sometimes people who have some movement in their legs will walk around a track. That equipment's very expensive. You're probably not going to get that in your home. I have had some people who have, but that is really a rare bird. So that's kind of way out there. Biking, again, is using electrical stimulation to stimulate the legs of your nerves. I told you about the FES bikes. They are difficult to get. They have been difficult to get. They started out at 40,000 years ago. They went down to 20,000. The prices went back up again, but guess what? There are a lot of competitors, and there are some that you can get about between $10,000 and $12,000 now. So if you do your homework, you know, you might be able to apply for that type of bike more easily than say a $60,000 or $80,000 bike, which does have a lot of bells and whistles. But they're all good. All the different bikes are good at different levels of functioning, but they all give the same basic outcome. Here's something interesting that happened out of the University of Washington in Seattle. Whenever we do electrical stimulation, we always put the electrodes on the muscles that we want to work, so on the skin. So, you know, you might put some electrodes on your arm to make your hand work. You might put them on the upper arm to make more function in your arm. So at the University of Washington in Seattle, they put the electrodes right at the back of the spine, right over the spinal column on the skin, on the outside of the body. And they thought, well, let's try with people with tetraplegia, so who have some arm involvement, and let's see if they can get some better function in their hands. And we think maybe it'll probably take a couple of months of training. It took about 2 weeks, and people already started showing a better function in their hands. So, think about these kind of things that are opportunities. You can go online, you can look up University of Washington tetraplegic hand function, and the protocol and everything, the articles would just come up. So, it's like, whoa. So can you take that to your own healthcare provider and see if you can't try that as a therapy, if you're interested in these things. Not everybody's interested in these things, and that's okay. But I just like to point out that things are opening up and things are getting much better in being able to get some of this equipment. So with that, let's answer some of these questions. So the first question is about someone who is going to the rehab center but can only get there once or twice a week. Do you recommend any equipment? Well, yes. Oh, here, Peter just said he just finished today's regularly scheduled FES. All right. What would I recommend? Well, standing, number one, that's the easiest equipment to get. If you are interested in any of the others, talk to your healthcare professional to see what is right for you. You don't need to have all these things, maybe one thing, maybe later on you can add a second thing, but see what is right for you. Another thing that I recommend for people to do at home, which is often something that they know about, but they kind of forgot about, or time gets in the way. There's this thing called life going on out there. We all recognize that. But doing stretches, a range of motion exercises, that stimulates all the muscles in your body. It helps reduce bladder infections. It can improve your bowel function because, all the muscles work together. So when you're moving your legs, you're moving the muscles in your lower abdomen as well. That they can be stimulated as well, which shakes the bladder, which decreases those UTIs, helps the bowels move around. So doing those stretches, a range of motions exercise, again, start out, if you haven't done them in a while, start out very slowly, check to make sure, because you don't want to dislodge a blood clot or any horrible outcome, but check to make sure and get doing your range of motion. People who do their range of motion get a mental benefit as well. People who are moving their bodies, even though they don't feel their bodies moving, have a mental benefit of having their body being moved for them. It kind of gives you a better outlook. Just as runners who are going out and they run and they say they get that runner's high, you're probably not going to get that from stretching. I sure have been trying to get it from really quick walking. And one time I think I had it. I was really excited. But it does make you feel better to have your body moved. And so it's that I think is one of the best things to start. And then that gets you in shape while you're waiting to get some of this other equipment. Now, this is a really interesting question where somebody has written in about something called a med bed. And this is kind of a new thing. And so that if you look up med beds, you'll get a whole lot of different answers about what a med bed is. So some people call a med bed that are beds that are adapted for different things, like the nurse call bell is adapted, or the ability to turn on and off your light in your room or adjust the heat can be done verbally. And some people call those med beds. That is what they are called. There are other med beds that do other kinds of things. So a few people in the world, maybe they've had back surgery, they've had different things happen to them, and they can lay and they can stand, but they cannot sit because of the pressure on their back. It might be temporary, it might be for a longer period of time. So there's a med bed that is a hospital bed, like in its regular form, and you can adjust it in different ways, but it also, as one whole piece, adjusts up so that you're in a standing position. And then if you have the ability, you can just walk right off your bed. So you don't have that bend and that, moving of trying to push yourself up and distorting your spine. So that's kind of a cool thing too. Now, I think what this person is talking about is it's a med bed that is being advertised as will restore your cells. And what those generally have is this vibration in it. So we talked about vibration therapy. When you do vibration therapy, You tend to do that only for maybe, well, starting out much less, but maybe 20 minutes at a time. Maybe some people will work up to a lot more time as they go on, but it's usually not something that you do all night long while you're sleeping, that kind of thing. So these med beds are brand new. I have not seen the research about them. There's not a lot of information out there about these beds, but I have heard of them. And again, I say to you, if there's something that could restore your cells by sleeping, wouldn't that be wonderful? I'll lay down and sleep, and when I wake up, I'll be much better. Well, vibration does. I've tried vibration therapy. I had a sore knee once, and I tried vibration therapy at a rehab conference, and wow, did it make a difference? That's a lot different than spinal cord injury or brain injury or a neurological disease. But it was just neat to get that quick response. But so think about this med bed. There's not a lot of research out there. If there was something that you could sleep on that would make a huge difference to a person with spinal cord problems, again, I think the whole world would be hearing about this. I think it would be on the evening news. I think there would be a lot in the rehabilitation literature. I think we would be seeing experimentation on the clinicaltrials.gov website. If you're interested in more information about any of these therapies, you can always go to clinicaltrials.gov. Federally supported research is printed there. Now, it might be done in an area where you don't have access to that, but you can look at what the qualifications for that is. You can look at what they're trying to demonstrate. And when that study closes, they'll have the outcomes of those studies. So it's a great place to educate yourself. So for this particular person, they had a herniated disc, they have osteoarthritis. Just be checked with your healthcare provider to find that much intensity of vibration. Now, some of them do intermittent. So there's a whole plethora of options, but check to make sure you have the right thing that's the right thing for you. For a herniated disc, I can see the physiology. If you lay a certain way that you're trying to get that fluid from the spine that's in the herniated part of the disc, you're trying to get it to shrink back into the spinal column. So would that vibration help that? Well, it makes sense that it would help that, but would it make it worse? Well, that we don't know. So, check with your healthcare professional, because there's just not enough information out there in the general public. And my strongest belief is if this was really a solution, we would all know about it by now. So it's something to think about. And thank you for bringing it to our attention, because we'll keep a watch on that and just see how that all pans out. Okay, here's a person with a bowel issue. Their bowels have stopped responding to the magic bullet, and the enemy is after 20 years of SCI at C5. They're using fiber supplements and Miralax and looking for some advice. Well, this is the thing about bowel programs. They work great until one day they don't. And it just seems like it's one day. It's really a matter of time. But and some people never have problems with their bowel program. And it's shocking to people who do, because it seems like people have a lot of trouble with it, or they have no trouble with it, or they have no trouble with it until all of a sudden they do. So, the guidelines have changed. Now, with the fiber supplements at C5, they're recommending not to take those anymore, because people can't take in enough fluid to keep the fiber activated, because after spinal cord injury, the bowel is moving slower, tends to slow down. And the whole time that waste is going through your small intestine, your big intestine, nutrients and water's being taken out of there. So you have to drink exorbitant amounts of water, because the bowel's moving so slow. So by the time it gets through the end of the bowel, it's really hard. And the fiber what they're finding is that when this happens, the fiber's really clogging things rather than helping things. And, you know, for me, whenever I talk about bowels and I talk about fiber, you drink, 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 drink. You cannot drink enough. Some people can't drink a lot because they're on a bladder program. But really, it's almost humanly impossible to drink enough if your bowel is that slow and you're taking in the fiber. So first of all, you might want to try going off the fiber. Now, maybe fiber's worked in the past. Talk to your healthcare professional about doing this, because you could go off the fiber and create an impaction from other ways. So you really need to discuss all of this with your own healthcare provider, who will know what's unique to your body. But if you stop the fiber supplement, your bowel might pick up still drinking water, because the fluid is what makes it go. Look at your diet. If you add something that, you know, like beans, you know, beans, the magical fruit makes you toot. I guess it's a vegetable though. I don't know. Anyway, look at things that, you know, go through the bowel really fast. You can check your own bowel transit time by eating some corn. Have corn at a meal, then don't eat it until you see, don't eat any more corn, eat other things, but don't eat any more corn until you see it in your stool. That's how long your bowel transit time is. So that's a good piece of information. Now there's all kinds of medical tests to check your bowel transit time, and they test other things, and it's wonderful information. But if you're just curious about that, eat some corn and then check and see. That's how long it will be. So that's another thing, adding movement. Is so overlooked. When the body is stagnant, there's nothing that really propels the gas forward. I know there's a question further down about a person who's having problem with gas. It's because of lack of movement. When people are up, walking around, bending, picking up things, they're moving, that is all stimulating the bowel. When that function is not occurring, the bowel is not getting that extra oomph. So even doing those range of motions, if you have a tilt and space wheelchair, tilting yourself, every time you're doing a pressure release by pulling yourself up, you're affecting the gravity is affecting what's happening inside your abdomen. So that's another option. Every time you're doing, you know, it helps you with your skin, but helps you with your bowel. If you're able, and don't try this on your own, be sure somebody's with you because of having difficulty knowing where your body is in space. But if you can tilt and do tilting over the side of your chair on each side, that helps move things along in the bowel. If you can lean forward, now again, have somebody with you when you're doing these things, because if you have trouble with proprioception, you could be leaning forward and topple right over or topple out the side of your chair and not realize that it's happening until gravity's pulled you out and you can get hurt. So always have somebody with you until you learn how to do that kind of thing. So that would be the advice that I have. If you can increase your movement, and then talk with your healthcare professional about the fiber. The Paralyzed Veterans of America put out guidelines for people with spinal cord injury. They're fabulous. They're all research oriented. And this last one that came out was for people with higher level injuries. They're giving up the fiber supplements. If you're taking them and they're working fine and you're happy with it, you don't need to do anything, but you know, just check with your healthcare professional, make sure it's still fine. But that is something that I would talk about, is that the fiber supplements, because of the length of time of your injury and maybe not being able to get that water in, maybe that's not working so well for you anymore. So that's another issue. Another thing is also check out the Reeve Foundation. There's a lot of information about things that you can do in a lot greater detail. Another thing to do is, another question is about UTI issues. This again goes along with the immune system. So how can you help build your immune system? So there are some foods that help build your immune system. So keeping a healthy diet, keeping your body well hydrated, looking at your technique to make sure that catheter is not touching anything. It's we find that a lot more, it's not so much we always say, look at your technique, look at your diet, look at your fluids, because, review the basics, make sure you haven't, taken a quick sidestep or something. So we always recommend that, because usually that's where people will find their issue is. But also with the immune system, some people tend to have more UTIs than other people. So be sure and check with your healthcare provider. If you have a UTI, get it treated sooner rather than later, because the sooner you treat it, the easier it is to treat. Sometimes people think, well, I'll wait and I'll see if it works out. And by then the UTIs really got multiplied and it's really got a good hold on you. So the sooner you get it treated, the easier it is to treat, and the lower level of antibiotic can be used to treat it. So antibiotics come in what they call generations. So like the penicillins are like the lowest generation, and there's some others in there. And then it keeps working up. So more antibiotics keep being discovered. So as you work up that system, those higher ones, they wipe out a variety of bacteria, but usually an infection is one type of bacteria. And so if you just treat that one type, you can use that one that's specific for that. That saves those higher level antibiotics for when you need them later into something else. Again, movement, shaking up that bladder. If the bladder's just sitting there in your body and you're not moving, you're not doing too much there, then that bacteria has time to clump together to find other bacteria or to clump onto your bladder wall. And then it loves that. Look at the amount of sugar that you're taking in, because sugar feeds bacteria. These are all kinds of things. And also we have booklets that have a whole lot of tips and techniques through the Reeve Foundation of things that you can do to help manage those UTIs. Here's a fellow that, a person who got a suprapubic catheter, and he thought that it would reduce his number of UTIs. So this, all goes hand in hand. Yes, actually, research evidence has shown that there's less infections with suprapubics, which is kind of an odd thing, because that catheter is indwelling. And whenever you have something that's permanently in the bladder, it's an open conduit for infection to get in there. We get Foley's out of people indwelling catheters that go through the urethra, drink water. And so be sure and do that. Now I'm getting a message that my connection's being unstable. It's gone now. So I hope that didn't interrupt too much there. There's a follow-up from somebody. I always love hearing from people in follow-up, because it helps me know if I was helpful, and I like hearing stories like this where things are going better. So this person now he's home, and they've gotten permission to get a wound back. Now this is a stage 4 pressure ulcer. So stage 4 pressure ulcers are in the category where there's treated with surgery, this wound. So I'm getting the message that I'm being unstable. So I apologize for that. I have everything else turned off. So we'll see how this goes. So this is a good sign that they're going to try wound vac on this. Now, the issue is here for about 2.5 hours. Whenever you're sitting on the wound, 2.5 hours of pressure on the this is going to but it's the truth. The reason why we turn people every 2 hours is because they're improved since then. Well, yes, they have. There's been lots of research. Those capillaries, and it takes very, very little. We are always just kind of moving and working and doing different things, moving our bodies around to release pressure. So the more pressure you releases you can do, the better off you are. That's why we say do pressure releases at every 10 minutes, not every 2 hours. On the area when in bed, the wound vac will be wonderful to help take away some of that debris. You'll find that it's very successful, and it will take some to do this. Once you just, I just got a message to call in by phone, but I don't have my phone with me, so that's a problem because it rings too much during these things. So I'm going to persevere on for these last few minutes, and we'll see. I'm hoping it's doing okay now. If surgery is necessary, then people will have to lay off their pressure area for months. You have to do that. So stay off of it as much as possible. Look at that diet and keep going. So I'm wondering, since we're close to the end of time and since we're not working very well here, I'm wondering, Kaylee, do you think maybe it's better just to sign off at this point in time?
Hey, Linda, I think,
So,
oops, sorry.
yeah.
I think that's okay. It keeps going in and out and freezing.
Oh,
It,
I'm so sorry.
no, no
Should I
worries.
continue or?
It,
Okay, okay. Um, I'll just keep going then. There's somebody here who's having spasms, and they're on a lot of medication for their spasms, and they're taking several different medications for their spasms, and now the doctor's recommending CBD oil. There are some people who think that this is just great, some people who say it did nothing for me. So, it would be up to you to try that if you want. Another thing that you can do is Botox injections. Those take care of spasms just right away. Some people don't like the idea of taking Botox, but it's injected into the muscle. It reduces the spasms. You do have to go back and have it redone. A lot of people are opting more for the Botox than the oral medications because they make you so tired. They give you dry mouth. And so they're able to get off their oral medications, but they go on Botox injections, and that's all they use for theirs. So it's another suggestion that you might want to talk to your physician about, although maybe you'll try the CBD oil and you'll say, hey, this is just swell. So the next question is, does SCI make us more likely to contract COVID? It could be because of immune system issues. And we don't know who has immune system issues, who has them severely, who has them a little bit, and who has really not really much issue with them at all. So that makes it difficult. So yes, people with spinal cord injury, people with any neurological injury really qualify in that group as immunocompromised. Should we wear a mask even though vaccinated? I do, but that's my personal issue. Now in the United States, we've been given the go-ahead that we don't have to wear a mask. In European countries, they still have to wear masks. Now, they have a lot more issues with this variant that's coming from India, because you can see geographically they're closer. So they have a lot more issues with that. It's more of an issue for them, and nobody knows if, well, the vaccines it's been discovered that they cover for the variants. I do not know that it covers for this variant from India. I wish there was a different name for that. So that is entirely up to you if you still want to do it. And I know somebody asked in, is there something to use to clean their wheels? Because they're being still cautious about this. And I appreciate that. And cleaning wheels, it's kind of a pain because, it's a lot of territory to cover. So there are things that you can buy that are expensive. There are wheel cleaners that you can go through that wash your wheels. Hand sanitizer wipe, one of those Clorox wipes or other wipes, and you can wipe your wheels down. Another thing is that you can use antiseptic spray, that people clean their bathroom with to kill germs. I'm going to say Clorox brand, but any of these brands that you use, just that you can spray. I see one advertised on TV, Microban. They say that is also kills the COVID virus. Clorox kills COVID virus. So those are all things that's possible. That's a little bit easier, is to spray. You might not want to inhale that, so maybe you want to try the wipes. So those help out too. Can the COVID vaccine cause nerve pain? There are some cases that have been reported in individuals. Now, this is particularly asked for paraplegics, but the cases that were reported were in people who were not paraplegics. So that tells me that if anybody can get it, people who have paraplegia can also have that. It's very, very rare. So talk to your healthcare professional if to weigh those risk imbalances for you, because it's very rare that some of these side effects have occurred. In actuality, the side effects of these vaccines have been so minuscule. There's that issue with the Johnson & Johnson and the blood clots. That's pretty big. But the rest of the incidences have been kind of small. There's been some people who have developed shingles. That gives you nerve pain. That could be the issue. For some people, it might be a benefit if they haven't had the shingles vaccine to get that first. Then you have to wait a certain amount of time to get the COVID vaccine. But again, weigh your risk and benefits, because the chances of that happening are so small. It's probably more important to get the COVID before you get the shingles. But there again, you need to speak with your healthcare professional about that. One more thing that was really interesting. It was a question about foot drop. And this is with a person with a C3-36 injury, and they're interested in driving, but they have a foot drop. Now I'm gonna assume that this is a incomplete injury. But because apparently you must have some function in the leg, because they're worried about driving. Well, first of all, you can always use hand controls. That's the right foot that has this foot drop. You can always use hand controls. So you can get those in a vehicle that has them installed in the vehicle, or you can get an attachment that somebody can put in any vehicle. So hand controls are a possibility. For foot drop, there are many things. There are expensive splints that you can buy. They can be fabricated, that are unique to you. They can be big and heavy. There are lighter splints. There's a plastic splint that you can buy even over the counter. It comes in small, medium, large kind of thing. And it's just a plastic piece that goes on the bottom of the foot and then up the calf of the foot. You put it inside your shoe, and then that keeps your foot from dropping down. Again, it's a simple solution. Some people don't like those. They say they're hot, or they're bulky, those kind of things. The thing that I see that most people like, and I see a lot more people who have stroke that use these than people with spinal cord injury, but there's no reason why anybody can use them. It's like a little Velcro cuff. It's about 2 inches wide, and it goes around the ankle. And then there's a strap that attaches to your shoelace of an athletic shoe, and it holds your foot up. And people love those. I've seen lots of people use them. You can get them right off the internet. I've seen lots of people use them. They're inexpensive. They're comfortable. I've never heard a complaint about them, although I'm sure some people don't like them, but I personally not heard a complaint about them. And the most important thing about these is that they work. And so I think when, let the less is more theory. So, there's another option for you. So it's a foot drop splint. You could call it, maybe search on ankle foot drop splint, but look for foot drop splint, just Google it, and I'm sure they'll come up because they're pretty popular out there. And with that, I apologize again about the instability. I don't know what that was about, but we'll have to figure that out on the back end. And with that, I thank you for coming. Remember that I am on the community on the Christopher and Dana Reeve Foundation. I'm on the community every Wednesday night. That'll be tonight at 7 o'clock Central Time. So if I did not get to your question, you can email me through the community if you'd like a direct answer, or you can put your question on the community and I'd be happy to answer that for you. So thank you for coming today, and I hope I see you next month.